Hello dear students, myself Dr. Maddineni Srinivas, your dermatology faculty. So in this video we are going to see the INICET May 2024 dermatology recall MCQs which were asked on 19th of May. So let us begin our discussion. So MSD, Dr. Maddineni Srinivas, dermatologist, you can remember me, and these are all the actual topics which are very important for INICET as well as NEET, and you can see most of the questions which are asked today are from these topics, and we have discussed most of these questions in the INICET marathon session. And you can send me a hi on this WhatsApp number to join all my dermatology groups, and you can scan this code or you can check out the links in the description to join my dermatology groups. And in this video, we are going to see the answers and why other options are not the answer. No nonsense, only dermatology. And these are recall questions. So if there are any mistakes or changes or you feel if there is some modification or alteration needed, please put them in the comment section. And this is an exam. Just consider this as a grand test which you have written before the NEET PG. NEET PG is your main target now because this exam is done. So in the comments, write down focus if you want to start the NEET PG preparation again, revisions. So this was a question which was asked. Annular lesions are seen in all except. So before answering, you must be knowing what is annular lesion. So annular lesion is any lesion which is a ring shaped lesion which is having different periphery and a different center. The center may be having clearing or center may be having crusting or scarring, whatever it is, periphery and the center will be different. How can you remember this? A simple trick which all my students do remember. Remember the vada. So what is this vada? So you can see here, this is called as a vada, which is similar to annular lesion. How? Because it is going to have a different periphery and a different center. So isn't it? You can remember, yeah, annular spelling has two A's in it, just like vada. So this is how you can remember both analogous, and in the actual question, you can see that tinea corporis, porokeratosis, pityriasis rosea. These three conditions are going to have the annular lesions, and I know that porokeratosis was till now not asked any time. It was not given in the option, so most likely you might have not read about this. But remember, in urticaria, what are the lesions which we are going to see? They are the wheals. We are going to see wheals which are going to have a central pallor and peripheral erythema. Pallor and peripheral erythema. Center will be having edema basically. So this lesion is not a annular lesion. So answer is going to be option C, urticaria. And porokeratosis, please remember, I will just tell you one point. This is a disorder related to abnormal keratinization, in which at the periphery we are going to have a ridge-shaped coronoid lamella. Ridge-shaped coronoid lamella can be seen, and at the center there is going to be clearing. This is the next question, and this, if it was asked in the actual exam, I can say is the most easy question. Why? Because you can easily rule out the options. See, tinea, it is a fungal infection. So what we can do, we can perform a KOH mode. We can perform a KOH mode. So B is going to be the answer. Lepromatous leprosy, we can do a biopsy or we can do a slit skin smear for the diagnosis. Okay, so in the options, A is there, C is also there. So now let us move to the next, lupus vulgaris, which is a cutaneous tuberculosis. Cutaneous tuberculosis, we can do a biopsy in which we can see granulomas. Okay, so we can put A here. So we can put C here now. Allergic contact dermatitis, the investigation of choice is a patch test which works on the principle of the identifying type 4 hypersensitivity reaction, and it is an investigation of choice. We are going to have readings taken twice. The first reading at 48 hours and the second reading, which is the best reading, at 96 hours. Okay, so this is going to be D. So B, C, A, D, option A is the correct answer. So please remember, these kind of match the following questions are actually very good to get the correct answer. You can easily answer by at least ruling out one of them. So which of the following drugs in leprosy treatment causes hyperpigmentation? So now leprosy topic is important. The question is asked related to adverse effects. So this we can say integrated dermatology and pharmacology MCQ. Please remember dapsone, it is associated with methemoglobinemia and dapsone hypersensitivity syndrome. Drug rash will be there. Rifampicin, it is associated with orange red discoloration of the urine, and also it is hepatotoxic. Now clofazimine, please remember clofazimine is going to produce in the skin dryness, and also this can cause pigmentation. This can also produce GI obstruction, gastrointestinal obstruction. So these are all the important side effects of these medications which were given, and these are some of the images which you can see are associated with clofazimine, which is producing the pigmentation, and this is going to stay for a period of few months to years after the drug is stopped, and ultimately the pigmentation will fade away, but it will take some time. So you can see here again coppery red pigmentation due to the clofazimine in a patient of leprosy. And I have one mnemonic for all of you to remember all the important pigmentation producing drugs medications. So it is MCAB. So I hope all of you remember in the acne we are going to use minocycline, which is associated with pigmentation in the acne scars. C for clofazimine, which is asked in this question. A for amiodarone, which can produce bluish discoloration of the body. B for bleomycin, which is associated with flagellate dermatitis and flagellate pigmentation. Very, very important. All these medications which you need to remember. And this was the next question which students told. Which form of vitiligo becomes stable and non-progressive among these options? So please remember the answer here is going to be segmental vitiligo, which presents in the childhood, as depigmented lesions which follow a single dermatome unilaterally. And remember, this is going to stay active, or it will progress for 1 or 2 years, and after this, so you can see segmental vitiligo full extent within 1 to 2 years and remains restricted to the initial segmental area. It will not progress, it will become non-progressive. This is from Bologna and this is from Brooks. Both these are standard textbooks of dermatology. So here you can see, so we can see segmental vitiligo generally starts earlier in the life and often stabilizes within the first year of the onset. So this is segmental vitiligo undoubtedly. This is the next MCQ. Drug resistance is most seen in which STI? This we can see is again a integrated MCQ with pharmacology. Answer here is going to be gonorrhea, Neisseria gonorrhea. So please remember this is Neisseria gonorrhea. And this is the next question. Mother had painful vesicular lesions over genitalia 1 year back. Now baby is born with features of meningitis and fever and rashes over the abdomen and forearm and died within a week. So scrapings showed multinucleated germ cells from this child's body. So what could be the answer for this question? So I hope this was the exact question. Please put in the comment section if this was the exact question. Painful vesicular lesions over the genitalia having painful lesions. The diagnosis, the DDs can be chancroid and herpes. The DDs can be chancroid and herpes. But if there are vesicular lesions, then we are going to have the diagnosis of herpes. So here the answer is going to be HSV, which can lie dormant in the ganglia, and it can be spread to the child, and it can manifest as neonatal or congenital herpes simplex, which can manifest as meningitis and which can manifest with lesions over the body. And of course we can see multinucleated germ cells in the scrapings. We can also see acantholytic cells also. Acantholytic cells also can be seen, which are also called as Zang cells. So answer is going to be HSV2, herpes simplex virus 2. So I hope this video was helpful. Please do hit that like button if this was helpful, and these were the exact questions, and these are the important topics which you need to read before the NEET PG. And this exam is done. So now focus, concentrate on the NEET PG. Write in the comments focus. Please do subscribe to my YouTube channel. if you wish to get this kind of dermatology related videos on a regular basis, and you can put in the comments whatever doubts, queries you are having. And most importantly, I will say, don't break your head. Exam is done. Please now only focus upon the upcoming exam, which is the NEET PG, which is the main target. Put in the comments, focus, focus, focus. And we are going to come up with the proper video in the Cerebellum Academy app as a recorded video. You can watch that out, and you can send me a hi, and you can get the links for all these social media. Join and ask your dermatology related queries in them. Thank you so much, friends. Happy learning dermatology. Bye bye. See you soon.